Meeting law requires that I notify the public that this meeting is recorded. Therefore, please be aware that an audio and visual recording of this meeting is being made by Boston City TV, a part of the City of Boston Office of Cable Communications, and is being broadcast on Xfinity Channel 26, RCN Channel 13, FiOS Channel 962, and live streamed on YouTube. And I will turn it over to our board chair, Wes Ireland.
This is Wes speaking. Thank you, Andrea. Good evening, everyone. I'm going to just go ahead with the board meeting agenda. The meeting has already been called to order. And we will begin, as we do, with introductions. I'm going to go first. Again, my name is Wes Ireland. I am the board chair, and I'm a deaf person. I will be using American Sign Language throughout the meeting, and the voice that you will hear is by 2 female sign language interpreters, and I live in the North End. And I will call on people in the order that I see them. So I'll call you by name. At the moment, I see Jerry. So Jerry, would you please introduce yourself?
Sure, happy to, Wes. My name is Jerry Boyd, and I'm a member of the advisory board, and I live in West Roxbury.
This is Wes. Thanks, Jerry. Thanks for doing that. Paulette, would you introduce yourself, please?
Good evening, everybody. My name is Paulette Flett. I live in the Mattapan section of Boston.
Thank you, Paulette. Charlie, would you introduce yourself, please?
Hi, my name is Charlie Kim. I'm a resident of the North End, and I'm on the advisory board representing parents and caregivers of children with disabilities.
Great, thank you. Carl, it's your turn.
Yes, hi, my name is Carl Richardson. I live in Brighton. I am the secretary and of the board commission, and I identify as deaf one.
Thanks very much. Zari.
Hi everyone, my name is Zari Amir Hosseini. I'm a resident of South Boston, and I'm a member of the board.
Thank you. Paul, go ahead, please.
Hi, my name is Paul Karen. I live in the West End. I serve as the vice chairman of the board, and I serve as an advocate for mental illness. Thank you.
Thank you, Paul. Richard.
Hello, everyone. Member of the board, and I'm back there. So I don't know.
This is the sign language interpreter. I'm not hearing Richard. Are other people hearing Richard?
This is Andrea. Yeah, we're not hearing you in the room either, Richard.
This is Carl.
This is Wes. Richard, now you're muted. Do you want to try again?
System over here, but it's a little bit. Became too loud and clear for example.
This is Wes. Sorry, Richard. So we weren't able to hear that. But Ducio, would you introduce yourself, please?
Good evening, everybody. My name is Dusia Lvovskaya, Dusia for short, and I'm former vice chair, and I'm here, and just glad to see everybody. Thank you.
Mrs. West, have I missed any board members currently present? Okay. Commissioner McCosh, would you introduce yourself, please?
Sure, thanks, Wes. Hi, everybody. I'm Kristen McCosh, and I serve as the Disability Commissioner and ADA Title II Coordinator for the City of Boston. Glad to be here with you all.
Thank you, Commissioner McCosh. All right, I believe that's everyone. So let's look at our agenda and see where we will continue. Next on our list is approval of the minutes from our prior meeting. Does anyone have any questions or comments for the minutes from last meeting, which would be our March 2024 meeting? If there are no comments or questions with them as written, can someone make a motion, please, to approve the minutes as written?
This is Carl, I so move.
Thanks, Carl. And who would like to
This is
second?
Gary, I'll second.
Thanks, Jerry. Okay, so Carl has made a motion for the minutes to be approved as written, and Jerry has seconded. All in favor, please signify by saying aye or raising your hand.
Aye.
Any opposed?
Sorry, I meant to say aye. This is Jerry. I was muted.
This is Wes, not a problem, Jerry. So the motion passes. The meeting minutes are approved from March with no opposition as written. So moving on with our agenda, we have a presentation this evening from the Mayor's Office of Housing. So please join me in welcoming Amanda Kwok for her presentation about homelessness in Boston.
Hi, everyone. As I mentioned, my name is Amanda Kwok. I'm the Supportive Housing Division Director. And along with me tonight is Jim Green. I'll let him introduce himself.
Unmuted. Hi, I'm Jim Green. I'm the Assistant Director for Street Homelessness Initiatives and Coordinator of the annual street count of the unsheltered homeless census, the annual point-in-time count.
Thank you, Jim. And I will now share my, or I don't know if Andrea, if you had, perfect.
I'm happy to. That way you can be on.
Thank you. So Jim and I talked about just kind of giving some background information about Boston's response to homelessness and some context on how we're funded. So Boston's response to homelessness is through our continuum of care, also known as the Boston COC, and the United States Department of Housing and Urban Development, also known as HUD, awards homeless assistance program funds through 2 communities through the COC. COCs are a particular geographical region, and the city of Boston is one of the many COCs in the nation. And it's a community-wide planning with the goal of ending homelessness, with the goal of providing funding to quickly rehouse people experiencing homelessness, promote access to effective use of mainstream programs, promote long-term stability, improve data collection and performance measurement. Each COC has a lead agency, and as the Mayor's Office of Supportive Housing Division, we are the lead in the City of Boston. Each year, we submit a competitive annual HUD application, and we are leading the planning and coordination of all the above listed COC responsibilities. In addition to that, we are designated and operating the Homeless Management Information System, also known as the HMIS. And this is a database where all the different shelters, both on the family side and the individual side, funnel in. And then we also oversee designing a coordinated entry system for prioritization. So really being intentional in how we allocate resources. So for the Boston COC 2023 award, we were awarded $47.7 million on January 29, 2024. This is funding total of 43 projects, 39 of them are renewals, and we have 4 new projects. And HUD encourages COCs to prioritize funding for projects serving households with highest level of need, including those that are chronically homeless. And the definition of chronically homeless is individuals with a disability as defined in Section 401 by the McKinney-Vento Assistance Act, which outlines, living in a place that is not meant for human habitation, a safe haven, or an emergency shelter, has been homeless and living as described for at least 12 months or on at least 4 separate occasions in the last 3 years, combined occasions equaling 12 months with breaks separating of at least 7 consecutive nights. An individual residing in an institutional care facility for fewer than 90 days and met the definition prior to entering the facility. And any family with an adult head of household who meets all the criteria of this definition, including a family whose composition has fluctuated while the head of household has been homeless. And through the funding through HUD, these are some of the services that are available through our continuum of care. One would be permanent supportive housing, PSH, permanent supportive housing, in which housing assistance is long-term and ongoing rental assistance and provides supportive services for the individual client. Rapid rehousing is also considered permanent housing that provides either short-term, up to 3 months, medium-term, which is 4 to 24 months, tenant-based rental assistance with supportive services. Additionally, it also provides transitional housing. It provides temporary housing with supportive services with the goal of interim stability and support to successfully move an individual to maintain permanent housing. And then we also have supportive services only, which include outreach to sheltered and unsheltered homeless individuals and families, providing referrals to housing or other necessary services. And safe havens, supportive housing that serves hard-to-reach homeless individuals who have severe mental illness, who come primarily from the streets and have been unable or unwilling to participate in housing support services. And just to give a little bit of a recap of who we served in 2023, 936 total individual adults exited into permanent housing. And of that, 157 veterans exited to permanent housing, and 113 young adults, which consist of ages 18 to 24, exited to permanent housing. And I was actually able to run 2 other data points that I'll share here today that didn't make it to the slide. I'm sorry about that. 1,303 adult and children households, or families, exited into permanent housing. And of all the clients that we served, 46.69% of clients served report at least one disability. And then the way that we engage with different clients is through our consumer provider groups. One is the Boston Consumer Advisory Council on Ending Homelessness, also known as Back Home. It consists of 13 individuals with lived experience. They meet to discuss housing stabilization and issues related to provision of housing. And then we also have a Boston COC Youth Council, ages 18 to 24, who also have lived experience and talk about ways to prevent and end youth homelessness in Boston. So these are just some facts and some data metrics to share with you, but I'll also open it up to Jim if he wants to share any of his insights.
Thanks, Amanda. And just, for all of you, so just collectively, so I've worked on the annual application that the Mayor's Office of Housing is the lead on for HUD funding to fight homelessness for 21 years. The team collectively has done a really good job. When I came to the city, we got about $16.2 million a year. This last year, we got $47 million, about 3 times as much. And it's a very competitive federal grant program. Most of that funding, the award we got this year that was a record award, most of that goes into the renewal of programs that are predominantly used for the model that Amanda mentioned, which is called permanent supportive housing. That is supportive housing that has some degree of case management and stabilization assistance for people moving in, who, as Amanda suggested, and would be of interest to this board, have a high incidence of people with a range of disability issues that they're kind of living with and that are important to factor into their support for the housing that they move into. We are still finalizing this year's annual census. We have a lot to do data quality checks, et cetera. But our emergency system is, for individuals, is essentially overseen by the Boston Public Health Commission and some nonprofit agencies you may be familiar with, the Pine Street Inn, Rosie's Place. There are day programs at St. Francis House, and a range of human service providers, Bay Cove and Victory programs notably, and Elliott Community Health Services, and others that we work with. There are also a lot of folks in transitional units at the New England Center at Home for Veterans, which abuts City Hall Plaza. So you may be familiar with that program at 17 Court Street. And then emergency adult shelters where people can pretty much show up and seek a bed or seek assistance. Your board may be familiar with the fact that we are seeing a lot of asylum seekers and refugees, et cetera, who are also turning to the shelter system that has historically served just unhoused residents of Boston. The state oversees the family shelter portfolio, what's called emergency assistance, but we work closely with providers and partners. In fact, Amanda came to us from one of those agencies, Empath, that used to be Crittenden House. And it may be of interest to the board that the prioritization, when we apply to HUD, we have to explain who has a priority for certain housing resources. We work closely with the Boston Housing Authority, and so for example, their Section 8 program for non-elderly disabled persons, we use the Boston Housing Authority's standards and definitions for those housing resources. And for elderly and disabled, I would say the majority of our resources, almost all of them, go to people who have some and sometimes compounding medical, mental health, and often substance use histories, but not always. Our partners and provider network in the city are people who serve folks with very high kind of prevalence of people with disabilities. I'll just say I would be very interested in ways and thoughts that your board has of ways you might help advise us on any of the facets of our work where we could, be more inclusive and center. Amanda and I can talk with our colleagues about this, but whether a liaison to this board when we do grant reviews for proposals, or because I think that it's a facet of homelessness that unfortunately the prevalence of people with disabling conditions is high. We have done advocacy over the years. For example, HUD had a definition of chronic homelessness that Amanda touched on, the length of time that you're homeless, someone with a household with a disabling condition. Charlie, I heard you introduce your role on the board. You'd be interested to know there was advocacy that it used to be that the adult head of household had to have the disability, but very often there are children with significant burdens of disabling conditions. There was a lot of advocacy with HUD to expand the definition so that a family household would be eligible for a range of resources based on dependent children in the household with basic disabling conditions. So, but very happy to be here, and thank you all really for the work that you do, with the city, but also on behalf of the communities and constituencies that you serve.
Chairman West here. I just want to again thank you, Amanda and for your presentation. I think that we can open the floor at this point in time for any questions or comments that the board may have. I see that Charlie has raised his hand. We'll go ahead with that.
Hi, this is Charlie Kim. Thanks again for the presentation and all the work that you're doing. Mr. Green, I think I've seen several of your presentations when you go to neighborhood meetings. I think you came to the North End a little bit after the pandemic, I believe, to give a report to our neighborhood council, or was it before the pandemic? But there was a lot of activity going on, and you gave a lot of great information on how the neighborhood can advocate and also deal with some of when there's excess evenings, especially in the wintertime, when people are not entering into some of the facilities like the Pine Street Inn and everything. So that was very helpful, because it was a challenging winter, and then also there was a lot of overspill. So I appreciate that. In the presentation, I saw the metrics in there. I was always get surprised when I see actual numbers placed on these things. Are those total numbers of all that were served, or did you disaggregate to show specifically the numbers that pertain to individuals that identify that have at least one disability? Because I heard that there was a percentage, but I didn't know if that included, if that was the aggregate number, or if that isn't that number.
That was the net number. So the others were just, the total was the 936, and then I broke it down by veterans and young adults, and then had a separate metric for families.
Okay, and then follow-up question to that then, because there's certain categories like with veterans and also with young adults, do you have the ability to, I guess, cross-collaborate or use funds from other like Veterans Affairs, or if there's anything that like a student or a family crosses over into Boston Public Schools, that I wouldn't say a force multiplier, but to be able to add, additional assistance from different resources, or does it all, when these individuals fall under your purview, you are basically following them in those funds for assistance only come from the limited resources that you have?
I see Jim has his hand up, so maybe, Jim, you want to take a...
Yeah, if I could maybe try to help with that, and then someone can help me figure out how I lower my hand. So just to say, some of the numbers Amanda reported on, that's not the total number of households or individuals served in a given year through our shelters. Through the shelters, it's over 11,000 individuals. I think it's an extremely high number. For families, there's a high number that move through. And also, depending on whether we talk about the programs for individual adults or programs for family households, the prevalence of disability, that it probably is the aggregate number, but it may be tethered to people who are housed. Amanda was really digging for a lot of information. People who received supportive housing in the past year, the number of people who cycle through the systems is much higher. There's a broad array of other partnerships and resources. For example, the New England Center and Home for Veterans that I mentioned gets substantial funding from the Veterans Administration. Also, the Veterans Administration purchased housing vouchers from HUD, a program called VASH, the Veterans Administration Supportive Housing. And providers will get some resources through the state's veteran serving agencies. The Public Health Commission garners a lot of funding from the State Department of Public Health Bureau of Substance Abuse Services. We have a number of provider partners with funding from both the State Department of Mental Health. So Elliott Community Health that I called is the statewide PATH provider. PATH is an acronym for Program of Assistance to the Homeless. So there's a really broad range, most kind of similar to the side of our Mayor's Office of Housing that does housing development, where there's usually an assemblage of multiple sources of funding to build affordable housing projects. Our programs and resources, what we manage and administer and oversee here at the Mayor's Office of Housing is substantially the HUD Continuum of Care grant. although there are 2 or 3 other HUD programs that also come through us. But then most of our providers get, the state does some of the funding of the individual adult shelter system, et cetera. So, and then a lot of services that people provide are, some of them are billable to or reimbursable through Medicaid, Medicare, et cetera. Boston has the preeminent healthcare for the homeless program in the nation, and substantially their programs are through Medicaid, a little bit through Medicare, and then some particular grants for federally qualified health centers that come. So, yeah, there are many other sources of funding across the homeless provider continuum. We wanted to talk about what we center on.
Wes here. I did also just want to recognize Richard and Olivia have had their hands up for questions or comments. So Richard, you can go ahead.
Thanks, Wes. Amanda and Jim, thank you so much. I apologize if I missed this, but how many homeless residents are there in Boston? And what is and is there a percentage of them that are disabled? I'm not sure I quite got that. Apologies if I missed it. And then my follow-up question is, how do you intersect with this commission to address especially those with disability?
I was able to run a report through our warehouse. So to Jim's point, the dates I ran were from January 1st, 2023 to December 31st, 2023, so for calendar year 2023. And we had about, I think, 14,000 individuals that we've had, touches, services, either in shelter. And of that, it was, let me look at my numbers real quick. I believe it was 46.69% of the individuals identified as having at least one disabling condition.
So, Amanda, does the 14,000, is that a comprehensive total, or is that just the number that you would, is it whether they get services or not?
It's all clients of all ages. So it's, so very comprehensive. It's including families. So yes, and it's not just like exits to permanent housing. It's maybe if they're getting, support services only. So any touches within our service providers is where that number comes from.
So, but my question is, are there, I'd be incredibly impressed if every homeless person is touched by you guys. I'm sure you do everything you can to reach as many of them as you can, but is it really in the totality of what's out there in our city? I just see people, I'm sure we all do, in different parts of the city who appear to be homeless, and my gut tells me there are a lot more than 14,000 who are homeless, and maybe they're not all coming on your screen. It's no fault of yours, but or is it really, are you pretty confident that it's 14,000 and that's the population of the homeless in the city, regardless of whether you touch with them or not?
Jim, correct me if I'm wrong, I believe that is also probably including the family side too?
It is. Why don't, Richard, one thing that may be helpful, and I'm going to look over here because I have it up on my screen, but we do an annual point in time count, so that 14,000 is all the individuals, veterans, the unaccompanied youth seen by, say, Bridge Over Troubled Waters, the people that cycle through the family emergency shelter system. We also helped a lot of people through the pandemic with a program called Rapid Rehousing, which was up to 2 years of rental assistance for people. So it's all the people touched on by the programs that we fund and that report to us through a data system called the Homeless Management Information System. There is a report each year posted on the city website, the Homeless Census Summary, and I'm just looking at the 2023 totals, that's the count that we did in January of last year. And at that time, 169 people we saw during one night at the same time that we counted all of this were on the street. 1,343 individuals were in emergency shelter beds for adults. Many of them, there's a higher prevalence there of disabling conditions than overall for the system. There were 256 adults with no dependent children or families in transitional programs, and 35 in a Department of Mental Health specialized program called a Safe Haven. So we had 1,803 individual adults without children among all those categories. For families, we had 1,129 families at that time who were in emergency shelter, but that's 3,395, or about an average of close to 3 family members per household. And then a model that HUD kind of, that agencies moved away from of transitional housing. They were just 4 families and 2 families. So in that mix, there are some domestic violence shelters included, et cetera. So about 2/3, about 60% of the population of persons served at a point in time were families mostly in emergency shelter. But the data system counts other people that are in transitional beds and shelter programs, et cetera. So it's a kind of a patchwork quilt of multiple systems. The 14,000 that cycle through the system is partly reflective of the fact that, as all of you know, Boston is the major metropolitan city between Manhattan and Montreal. We have a lot of people who come into Boston from across eastern Massachusetts and the Commonwealth, and sometimes beyond, in part because we do maintain a safety net of shelter here. I anticipate, although we haven't finalized the numbers, that the numbers of people in shelter will increase this year because a lot of beds were added to address the asylum seeker and immigrant population that has been much in the news. And also just to restore the fact that we also have the opioid epidemic creates a lot of the visible homelessness that people sometimes see going around the city. But yeah, 14,000 that's actually significantly higher than it was sort of probably pre-pandemic. But a lot of it's people who are here sort of very briefly, maybe in a bed for 1 or 2 nights. It's unclear whether they're just unstably housed and ended up turning to shelter briefly, or whether they have longer-term histories of homelessness. But we use our data system to try to understand the people who've been in shelter and systems the longest and cluster around their needs. I would just say to your other question, I think that sometimes when the city has certain kinds of hearings, like the Boston Housing Authority's action plan, or we have our own HUD Continuum of Care action plan, at times there may be public meetings where your board and commission interact with us. I know that Commissioner McCosh and the staff include our director, Sheila Dillon, and other representatives around certain kinds of planning. So I think there's some back and forth, but I think there's probably more potential for cross-collaboration as well as we sort of do our strategic planning. Apologies to you, Olivia, if that went on a little long.
This is Wes, don't worry about that, that's fine. It's okay. So we'll move on at this point to Olivia and your comment or question. Go ahead, Olivia.
Yes, Olivia Richard. My question is, how many of the emergency night shelters, that very first point to contact, are accessible for people with disabilities?
I can take that one in a minute. So, Olivia, they are all required to be accessible. That doesn't mean they're all built and designed. So, for example, I actually worked at Pine Street Inn for 16 years before coming to the city. You know, They had to put in some, for example, ramps for people with mobility assistance needs that they had to build into the lobby, et cetera. There are some programs that are just, somewhat better designed. The large individual adult emergency shelters are, to my knowledge, all ADA compliant. There is one program run by Bay Cove Human Services, the Boston Night Center, where there is one elevator that's used. That's a place that's really more of a drop-in. It doesn't have beds, but it has, people can sort of, because of zoning and other things, it's people can sit in chairs, and after midnight they can kind of set up mats or things on the floor. It's unfortunate. It's just the original design was based on a program in New York. That does have a lot of stairs. It's next door to the former temporary home for women. If you went and looked at the temporary home for women during COVID, that building was vacant. It's over, I think, it's near Staniford Street or Bowker Street. You will see a very large accessibility ramp outside that had to be built and connected to, I think, a second floor entrance to make a very old municipal building more accessible for people. But places are required to plan and certainly renovate and try to make bathrooms ADA compliant. A number of our programs and buildings, Pine Street Inn's main building is in the former fire department headquarters that was built in 1892. Their women's shelter is a former sewing machine factory, but a lot of work was done internally to try to improve accessibility. They also have, and we report in our continuum of care, but all of those agencies have accessible services around translation, around sort of TTY and other things for clients who need, either deaf, blind, or having other disability needs. So as far as I know, that compliance it's a requirement actually, I think, of some of the licensing and to receive the city and federal funding. I don't know how much work the commission, your board and commission do in partnerships, but.
Hi, it's Kristen. I can jump in for a minute. Just to say that we've worked more closely with Jerry Thomas, who oversees the shelters that the city owns rather than Pine Street Inn, which are private nonprofits. So we have worked with them on like a policy for when the elevator's broken, and they have a whole policy where they can move people with disabilities into other shelters. And we've done some long-term planning with that part of BPHC. But always welcome to collaborate further.
Yeah, that's great. We'd be welcome to just get reflections from the board and the team at the mayor's office and think about hearing about other potential for partnership, et cetera. Jerry also retired after, I think, 40 years between city and state, so Gregory Gray Thomas is her successor. But we do try to center equity and access insofar as it's possible. And we certainly have language to that effect in all of the contracts we have with partner agencies who we're the pass-through for federal funding.
This is Wes.
Thank you.
This is Wes. I actually have a comment as well, a follow-up that I would like to ask after Olivia and Richard's questions. So I just read this eye-opening book, actually, and I wanted to mention this book that I got from the Boston Public Library called Rough Sleepers. And it addresses a lot of these issues of homelessness here in Boston over the last 40 years. And I'm amazed that you haven't talked about rough sleepers as opposed to folks who are experiencing homelessness, people who are sleeping on the street in that way. It's an older term for folks who aren't familiar with it. It's an old British term that was slang for people who prefer to sleep on the street. And I'm wondering whether the office is keeping track of data around those folks, folks who are what we would call rough sleepers. Especially information from the Boston Public Health Commission on that population.
So Wes, that's a great question, and I'll just say that when I was initially invited, that is the population. My title is Assistant Director for Street Homelessness Initiatives, and that's the population I've substantially served throughout my career with the city and prior to this. We don't use the term rough sleepers. It's a term that Dr. Jim O'Connell dearly loves. He spent some time at University of Cambridge in England and carried back that sensibility with him. But one thing I didn't mention is, in addition to the $47.7 million we got from HUD generally, last year we were awarded $16.5 million over the next 3 years through a highly competitive special funding opportunity to address unsheltered homelessness in Boston. I would be happy to come back in the future and give an overview of that. We have really robust partnerships with a range of providers covering street outreach, the medical van. The van in the book, Rough Sleepers, that Dr. Jim O'Connell goes out on, is actually the Pine Street Inn outreach van, which has gone to the street since 1986. I helped found Pine Street's daytime outreach program with HUD funding from this department that I now work for back in 1997. So I've worked with unsheltered populations for a long time. During the COVID pandemic, we started an initiative called Street to Home, which began in June of 2021 and closed out October 31st of last year. We housed 300 individuals who had been sleeping on the street, who had substantial histories of unsheltered homelessness, through a range of a strong partnership with Boston Housing Authority, a lot of COVID-related housing resources that were specially given to cities, et cetera. The funding we receive from HUD is about $5.5 million a year for 3 years, and we are just going through a list. We just assessed about 200 people with what's called a housing pathways assessment over the last several weeks. We have 372 housing opportunities for people who Jim O'Connell would refer to as rough sleepers over the next 3 years. We also have an executive leadership board, and it could be we can loop back with our team. It could be that having a liaison from this board and commission would help us to be as inclusive and thoughtful on issues of advocacy and support for people with disabilities, which I would say is easily 90% of the people that we see. Dr. Jim O'Connell's, Tracy Kidder gets that right, that there's a very high prevalence of the unhappy word, trimorbid conditions, high medical need or medical or physical disability, mental health and substance use needs. But yeah, that's the work I mostly do. I sort of deferred. I thought you might be interested in the larger picture of all the work the Mayor's Office of Housing does on homelessness. But that's my area.
This is Wes. Thank you very much. Any other questions or comments from the board?
All right. Well, I really do want to thank you both again, Amanda and Jim, for your presentations, and really, we've learned quite a bit about what you've given to us this evening. So I hope you have a very good night, and we can go ahead and proceed with the remaining of our board agenda. All right, so now it's time for the chairperson's report. There are 4 things I want to mention. So in my chairperson's report last month, I mentioned the bill that was sponsored by Governor Healy to remove the outdated and discriminatory terms used to describe people with disabilities. I just found out that the bill was passed by the State House Representatives and now is on the floor of the State Senate. That's what I'm seeing on the news and media. However, when I look at the Massachusetts Legislative Bills search engine website, it looks to me as if it's already underway with the House Way and Means, which the purpose of this bill would be to replace or rename the Massachusetts Commission, MRC, excuse me. It would be now Massachusetts Ability and the terms handicapped and disabled and the R word, and autistic would be removed and replaced with the currently appropriate terminology, person with a disability, and a person with an intellectual disability, and the autistic term would be replaced with the term autism. So with this being said, and with these new terminology changes, I'm not as concerned about the terminology and how we are as the Disability Advisory Council and the Disability Board. Secondly, there was an op-ed article in the Boston Globe about 3 weeks ago. It was in regards to someone's opinion on Governor Healy's budget cuts proposed, that feeling that it would be, it would really threaten about 50 years of disability rights, such as slashes of fundamental personal care services for people with disabilities. If legislators agree, it's approximately 6,000 people who will be losing as many as 20 hours of weekly support. And so that makes it, this support makes it possible for them to live with their disabilities, and in some cases they'll be removed and they'll be taken out of the care for others.
Allows them to live with dignity.
And then I also want to encourage the board members to schedule one-on-one meetings with me to discuss any ideas you may have for the board. Please reach out to me by email if you are interested in scheduling some time with me. And the fourth item I have tonight is with the later sunsetting happening throughout these upcoming months of May, June, and July. It tends to be that, the sun sets until after 7:30 until September. So I'd like to poll the board about possibly hosting an in-person meeting while hybrid will remain as an option. Maybe we can schedule one more month in May and see I was curious to know what the board's thoughts were. This will be the end of my chair report now, so if there are any other questions or comments, I'm open to them now.
Well, this is Carl.
Go ahead.
So, this is Carl, and there are a number of members who are new to the committee. Well, not new, but they're new since we went to hybrid format completely. And I think we should probably keep the majority of the meetings hybrid, but I wouldn't mind one meeting so that we could just meet everybody in person, get to know each other, say hello, and just get a sense of who everybody is. So I think it's a good idea.
Okay. Thank you, Carl. Any other thoughts or ideas? Should we take a poll and see if this is something we should do? Do we want to have an in-person meeting during the month of May?
This is Andrea. If folks want to just put in the chat or maybe do a thumbs up. This is not a Robert's Rules of Order official position of the board, so we don't need a
Wes,
motion.
can I make a comment?
I think that you're muted. So I'm not sure if you're talking.
I was going to make a comment. Were you waiting to speak, Andrea?
Can you hear me now?
We can't hear you.
Yes or no? Oh, okay. Hold on. I don't know what's happening.
While Andrea's looking into the technical issues, can everybody hear me?
Go ahead. Yes, go ahead.
Okay, great. I could also offer to, maybe we could organize a get-together in person after the community forum, which is 2 weeks from today. So if people are able to come and stay a little bit afterwards, we could always do that. I'll just throw that out there on the table.
Okay. Sounds good to me. Zari?
Yeah, I actually like that idea of maybe doing it after the community get together. I just want to be very aware that someone was immunocompromised. So this is really the best opportunity for us to do these meetings usually. So I understand that we're going to get together and see each other in person, and then I try to go to as many of these meetings as possible. But if it's not really necessary for us to meet in person, I would prefer not to. Just to be respectful of some of the members here who have not been able to attend any of the meetings. So just wanted to put that out there as well.
Thank you, Zari. I do know that, the idea of having it in person may not be the best opportunity, which is why I was suggesting maybe once or twice a year, and thought maybe that was like a minimum to ask for. I do see that Jerry has his hand up, and then Paul. Jerry? Not sure where Jerry went.
I apologize about that. I didn't realize I was muted. Thank you, Wes. This is Jerry. I would support getting together after the community forum, if possible. I would try to make any meeting, that we would have in person if I could. But I also second, and I appreciate Zari bringing up that for a lot of us, in-person meetings are very, very, difficult due to health and other reasons. So hybrid gives us the best opportunity to participate. But again, I would support, I plan on coming to the community forum in person, and so I would be happy to meet informally or formally there afterwards if that's what the rest of the, if that's what the majority of the board decides.
Okay. Thank you for that, Jerry. And Paul, I believe you were next. Paul?
Yes, I just got unmuted. I was on mute. I'm having a little trouble with the IT tonight. Yes, I'm for the in-person meetings, as we talked about in the executive committee meeting. I understand if people still have to go hybrid for whatever reasons, but I noticed that when we do in person, it is, a lot more personable, and we would get to know each other a little bit better. I'm not saying to come to every one of them, but pre-COVID, when we did have them, we were pretty effective, and we even all made a documentary. We put in the mayor's documentary about the city of Boston, which was real interesting also. It got into details about what we do in person and how we do our meetings. Thank you.
Paul for that. Andrea, I know you have your hand raised.
Thanks, Wes. Just wanted to clarify from a logistics perspective from, the staff here. All meetings would be hybrid, so there would always be that option. I think we were looking for a sense of, should we expect more than half of you to come, to a dedicated, somewhat in-person meeting? That way we can make sure that the space is arranged. Correct me if I'm wrong, Wes, we're not considering like a requirement that everyone comes in, but a poll from y'all about whether you all wanted to agree to maybe the May meeting, that those of you who are interested in person would may be a good time to come. Would there be a different month? That way we can just make sure we're prepared if you want to do that. But we do recognize that the community forum's in person in 2 weeks as well. So maybe for a poll, Wes, do you want to ask about May? If folks want to like indicate in the chat maybe whether they would be interested in coming to City Hall for the May meeting. Does that make sense?
Yeah, I think that makes sense. I think maybe, we can put it in the comments, your thoughts on this in the chat, and then from there, we can figure out, Andrea can update and track the chat, and then we'll save us a little bit of time and we can move forward. Are there any other questions or comments from my chairman's report? All right, thank you. Chairperson, I'm ready for your report.
Commissioner McCosh.
Commissioner McCosh, excuse me.
Thanks, Wes. And Andrea's going to share slides. Alrighty, so I'm just going to start off with some of the events that we're planning. As we talked about earlier in the meeting, the Disability Community Forum is 2 weeks from today, Wednesday, May 1st, from 2 p.m. to 3:30 p.m. at Suffolk University Law School on Tremont Street, the same place it was last year, or you could attend virtually by Zoom. And we did a fully hybrid event last year that worked out really well. We had a lot of people attend in person, which, as we've all talked about, the benefits of really getting to see each other in person, and it's kind of for a nice community interaction. But for those of you who can't, we know there are still concerns, like Zari mentioned. Zoom is a fine option. But I would love to know from the board who plans to attend. I know a lot of you attended in person. Almost everybody attended last year. So if you could RSVP to Andrea by April 24th, which is next Wednesday, that would be great, because we'd love to have as many of you as possible. And we're working on accommodations so that everybody can see the program. They won't have to be looking at the screen behind us. So we'll follow up about those arrangements as well. But everybody did a great job last year, and the community really appreciates being able to meet the board, because you really hold some standing in the community. Like when we mentioned the advisory board, people know that you were appointed by the mayor and that you really look at the issues that we bring to you and that you bring to us. So it's a great chance for you to meet the people that you elevate to the mayor. And then I will also present the commission's annual report for FY24. So that will just be a summary of all the work we've done in the office, and I'll also summarize work that the board has done over the last fiscal year, which runs July 1st through June 30th. We've also scheduled ADA Day for this year. That's going to be on Wednesday, July 17th, from 12 noon to 2 p.m. on City Hall Plaza, as usual. This will be the 34th anniversary of the ADA. So we love that it's a festive atmosphere with music and food. We always have great t-shirts. We're in the process of designing them now. So you have to come out to get one. Just kidding, we'll give you one even if you can't make it. But we also have a resource fair with 30 plus disability organizations and many city departments. So please spread the word when it gets closer to the date. Invite your people from your different networks and groups. We'd love to see a lot of people from BPS there, Charlie, and anyone else with big networks. Please invite everybody to come. This year, we will be recognizing the City of Boston Department of Innovation and Technology. We call it Do It internally. We're working with them, we're beginning to work with them on a citywide digital accessibility plan as part of our ADA Title II requirements as a city. So we know that the Do It department does a lot of great work now on access, but we're trying to bring it all together into a plan that can be transparent for the public. So stay tuned for more information on that this year. And then we're also going to be launching the Disability Data and Standardization Guidelines. And you may recall, I've been talking about this for a few months, but it's actually going to be guidance for city departments on when and how they should collect data on disabilities, what language they should use, and to be transparent about what they're going to do with any data that they collect. So that will be rolling out in the next month or two. So I'll have more information on that coming up. Next slide. So I thought the board may be interested in work that we have coming up for the year. And I know this was some feedback from the executive committee, like not to just report about what we've done, but to think about what we're doing that you may be interested in. So we have our budget hearings next week, and every year, every city department has to create their budget and outline their priorities, and then go before the city council to present what our priorities are and our plans are, and hope that we get approval for the fiscal year ahead. So we're entering FY 25, which will start, oh, I put the wrong date, July, oh no, yeah, that's right, July 1st, 2024 through June 30th, 2025. So that starts in July. So the things that we have outlined as our priorities for the year. First bullet is ensuring ADA Title II, ensuring access to disability, to city programs, policies, and infrastructure. So as you know, as the ADA Title II coordinator for the city, I am required to ensure everything the city does is compliant with the ADA. That's everything from city buildings and facilities like parks and pools to policies and programs. So in this vein, we're going to be updating the ADA Title II transition plan. All municipalities were required to create to do a self-evaluation and create a transition plan when the ADA was first passed. It was due to the feds in 1993. So we did create this plan, and there's a link to it on the slide deck, which we'll send out after the meeting. It's not very user-friendly. It was typed on a typewriter. It's certainly not complete. The city did the best they could, 31 years ago. But now we'd like to bring all the information together into a really user-friendly, transparent format, either a web page or some different tables and graphics that we can show you, like how much work the city has done to achieve compliance in school buildings and facilities and different policies we've implemented, like online voting and a lot of things like that. So that's one of our big goals for the year. We've also been working to create trainings for city departments on the requirements for Title II access, reasonable accommodations and modifications to policies, and effective communication. So we'll be working more on that this year. And then also, as part of that, we are working to disseminate tools to city departments to increase access systemically, things like checklists, language that they can put on their websites about reasonable accommodations, and other resources. The second goal that we have for this year is ADA Title III, which is improving disability access in places of public accommodation. So as you may know, I don't have any oversight over businesses that aren't under the purview of the city. However, we do have some ways to interact with these businesses through our licensing board and the Boston Transportation Department, which has oversight of the streets and sidewalks, things like trolley tours and things like that. We were just looking at recently restaurants that deny people access with a service dog, for example. So we are working in several different ways to increase this access. First of all, we're working on outreach and enforcement of the captions ordinance. We've had relatively few complaints, but we have had a few complaints of restaurants not being in compliance with the ordinance. So when we hear that, we follow up with them to remind them of their responsibility, and then we're able to take next steps if that doesn't change. We're also working on a training on free and low-cost barrier removal for small businesses, because we know they don't have big budgets to install an elevator or totally redo their stores, but there are lots of free and low-cost ways that they can improve access. So we want to work with the Boston Main Streets Department to get this training out to small businesses across the city. And then we're also working on sending a letter that if I do hear a complaint about a service animal being denied or something else being denied that is required by the ADA, we work on sending out a letter. We call it a do the right thing letter, because although I have no oversight of enforcement, I can still remind them of their responsibilities. And sometimes just getting a letter from the city is enough to make them think twice and assess their policies for compliance. And then the third thing that we're really going to focus on is financial empowerment and economic mobility of people with disabilities. So for years we did Disability Mentoring Day. This is part of a national initiative where different towns and cities can mark this day in October during National Disability Employment Awareness Month. So we always held a day in City Hall where we brought in 10 residents with disabilities who were looking for jobs and ready to go to work. So they would, we'd match them with different departments in City Hall, and they would have a day of mentoring. In the afternoon, we would bring in other employers who were looking to hire people and have like a mini job fair. So it was a really fun and productive event. But unfortunately, we stopped hosting in person during the pandemic, so we're hoping to bring that back this year. We are also, during the pandemic, we kind of pivoted to holding webinars online during National Disability Employment Awareness Month. So we've developed a really good one on how to get employment with the City of Boston. So we're going to do that again this year, but we also might increase the webinars to add 2 more. One about housing, because there are so many housing programs in the city for people with disabilities, so we want to spread the word on that. And then one on savings and banking, because people with disabilities have a lot of restrictions on income and saving and things like that. So we're going to try to put a webinar together on that. And then finally, we're talking about hosting either an interview or a hiring event for qualified job-ready Boston residents who are disabled. So that will be a one-day event where we have different city managers who are hiring, who have open positions, to come to an event, meet people with disabilities who are interested in jobs, and hope they have the ability to get an interview right on the spot. So again, I just wanted to give you a snapshot of the work we have coming up. If anyone's interested in more details or has questions, I'd be happy to talk through them more in detail. But for now, we can go to the next slide.
Commissioner, do you want to take question first? Or is
sure. Anyone have a question?
I have a quick question, Commissioner. So 2 quick questions. One, on the transition plan, you said that was submitted in 1993. Has there been given thought to update it to meet today's standards? Because there are a lot of best practices we do now that weren't thought of back then. So that's number 1. And number 2, I'm glad to hear that you're working closely with the digital accessibility team, particularly since DOJ just released for Title II entity that the new rulemaking on accessibility of websites and things like that. So that's perfect timing on your part. So that's great, because once that's enacted, cities, states, and local government will have 2 years to make sure all their web stuff is fully compliant. But mainly more on the ADA transition plan. Have thought been given up to update it to make it more current and more relevant?
Yeah, so I'll briefly touch on the second part of your question, which is the digital access. And yes, the new ruling is key, and we really want to elevate that. And I have to say, Boston's municipal government, our partners are really allies in this work. They already do a great job, and whenever we notice anything on a website that's not accessible or needs some tweaking, whenever we report it, they get on it right away. So they're actually very interested in pursuing this work with us. We've sent them to different trainings before, and they're always very eager to find out the latest information. So yes, it's a key time to elevate the work, and we will definitely announce the new ruling at ADA Day and make a really big deal about it, because we're excited about the prospects that this will bring. And then to talk about the transition plan, it's a little bit complicated for me to explain, but so the transition plan in 1993 was a snapshot of the facilities that the city had at the time. It was only a transition plan on infrastructure. It had nothing about policies or programs. It was just buildings. They did include pools and schools, as well as like city buildings, like City Hall and things like that. So when I say we're going to update the transition plan, I don't mean that we're going to be doing new building assessments, because the city continually does that. Like the Boston Public School department just did a full facilities assessment of all the school buildings in the city, so we have all that data. But if someone were interested, say Charlie were interested in seeing like which schools are accessible, it's a lot of data to get through. So we're in the process of hiring a consultant who can look at all the data that's been done. And I mean, I'm sure you know, but all the work the city does now is fully up to standard. They would never do a project that's not only not ADA compliant, but our office always pushes them to go beyond compliance, and they're very receptive to that. So we want, with this update, we really want to make like a portal that people can access the information that already exists. So we know the schools have done a full facilities assessment. Property management department is working on a facilities assessment of all city buildings. Parks department has some assessments. The streets cabinet has some sidewalk data. So we're just looking to pull all that together so people can see like how many miles of sidewalk we've done, how many curb ramps we've done. So you don't have to worry about the standards, they will definitely be met. But I can understand the confusion because when we say updating the plan, it's not like we're updating the standards. Those have been updated all along. It's just that we're trying to make the plan more accessible to people to be able to understand and find the data they're interested in. Does that make sense?
Yeah, so that's your way of complying with the rule that the plan has to be updated, what, every 3 years, I think, or something? But no city has done that, but I mean, so you're telling me the information's there, it's just a matter of how we access it, and you're trying to create a portal so we can access it more easily and be more easily understood by people.
Exactly, yeah, but in that plan, we'll also, we're going to start with the facilities, but we're also going to add in things like policies and programs, the different work we've done to make sure that the city's in compliance with the ADA, because it's a huge picture that we're trying to make digestible. So it will be done in different iterations, but we're going to start with the facility assessments that already exist. And, yeah, we're excited about it. Any other questions on our work or events? Okay. Okay, so then just a list of some City of Boston events that are coming up. The mayor just posted notice of her coffee hours. The neighborhood coffee hours are held throughout the city from April 22nd through June 26th. And you can click on the link, the heading link there in blue, to find specific locations. But they are held from 9:30 to 10:30 in parks across the city, weather permitting. They're sponsored by Dunkin' Donuts, so you can go out and have a cup of coffee with the mayor. The Parks Department gives away plants, so it's a really nice, it's an enjoyable event. You get to mingle with city staff and the mayor, and it's a great opportunity to speak directly with the mayor and other staff to talk about how you can improve parks, public areas, and other city services in each neighborhood. I know that some of you go, some of you are regulars at these events, but every department tries to get at least one staff person to attend every coffee hour. So if there's anyone that you're interested in talking to, this is a good place to reach them. And also, if you can't make it, or if you want to help inform what the mayor will talk about at these coffee hours, you can take the community input survey, which was just posted. You can ask a question that you'd like the mayor to discuss, or just list your concerns through that survey. And then the city also listed the open streets for 2024. There are an expanded number this year. I believe there are 6. So they're going to be starting in May and wrapping up in October. They're half-day events that allow local businesses to expand their goods into the street. They make safe space for communities, music, games, bicycling. A lot of city departments and agencies do tabling with information. So I don't know if you've ever gone, but they are a big deal. A lot of planning goes into them. My office is involved in all these meetings to plan, so we make sure that if blocks are, if the programming is in the street, that we have ramps in mid-block areas so people in wheelchairs or with mobility impairments can get up and down. We work closely to make sure that any buses that are diverted, that they get the information out to neighborhood residents. So there's a lot of planning that goes into it. But if you have any concerns you'd like us to look into or any questions, just let us know. Any questions on these events? Okay. So the last 2 slides I'm going to talk about have to do with the City Council hearing order. Most of you may have heard that Councilor Fitzgerald called for a hearing to discuss the potential of expanding accessible parking placards to those who are pregnant. And the word handicap is throughout this hearing order. I'm just going to switch it out for accessible because that's in the language of the law, as Wes talked about earlier, but I'll just switch it to accessible. So I just summarized some of the main points of the hearing order. It's not verbatim. I didn't have a link to the actual order because it's kind of hard to find on the website, but we can email you a copy of the order after this meeting so you have the exact language that the counselor proposed. But I'm just going to highlight a few of the points that are made in this hearing order. So it starts by saying the city has a rising population, which is causing the availability of parking around the city to become, it's an ongoing concern for citizens, and especially most vulnerable citizens, such as pregnant individuals. The council goes on to state that those who are pregnant may need access to accessible parking spaces for 4 reasons. One is for mobility issues because of physical discomfort or limitations during late-stage pregnancy. Medical conditions, sometimes people get gestational diabetes or high blood pressure. Safety concerns of being close to an entrance to reduce the risk of falls. And emergency situations. In the event of a medical emergency, having access to a disabled space may be able to expedite access to a facility. So those are the 4 reasons that the hearing order is wanting to discuss this issue. And then on the next slide, I just listed some more of the hearing order, which says the council is thinking that most pregnant folks in the last trimester have a hard time walking more than 100 to 200 yards. They could be short of breath. 2 states right now have a parking policy that explicitly includes pregnant women. It gives them use of a disability placard for 90 days. There's a bullet that says if a physician certifies a pregnant person has a walking disability, they may qualify for a temporary placard. And then the last bullet just says, along with examining logistics surrounding the current parking programs, such as resident parking and visitor parking, the city could use this as an opportunity to explore the potential need to expand it to pregnant people to get a temporary disabled pass in the 3rd trimester of pregnancy. So because of all this, it was ordered that this be given to the appropriate committee of the Boston City Council to conduct a hearing to review the potential for expanding pregnant persons in the last trimester of pregnancy to request a temporary placard for accessible parking. So my staff and I met with the counselor, and we talked through some of the issues related to this order. And really we approached it from a position of learning, because we felt from the things we read, we felt that the counselor wasn't as familiar with the current existing placard requirements that he may have been. Can you go back to the last slide for 1 minute, Andrea? The one that we wanted to point out to the counselor is the one that I highlighted, and that is the one that says, if a physician certifies that a pregnant person has a walking disability, they may qualify for a temporary disabled parking permit under both state and federal law. So this already exists, and that's what we wanted to make sure that the counselor knew. Currently, anybody who has a temporary disability can apply for a disability placard through the Registry of Motor Vehicles, if they're pregnant or not. And if pregnancy causes a temporary disability, that's a perfectly valid reason to be able to be approved for a placard. We also let the counselor know that it wasn't anything the city could approve. It would have to be done on the state level. So the only thing that the city council could do was to make recommendations to the Registry of Motor Vehicles. So again, we approached our meeting with the counselor as a learning opportunity to tell him about the disability community, some language, respectful language, and things like the program that exists right now. So there has no hearing has been called, but we will certainly keep you up to date if and when a hearing is called. But I wanted to bring it up because it was in the news. It's died down now, but we did hear from some people in the public with concerns about this. So I wanted to let you know that we are definitely on it. We're working on it. We'll work closely with the city council, and we will keep the public informed of any next steps, should there be any. A hearing may never be called about it. We don't know. But we do know that the city council is busy right now with budget hearings. So the budget will be the main topic of hearings for the next few months. So if there is a hearing, it won't be anytime soon. So I will leave it at that and turn it back to Wes to see if anyone has questions.
Thank you for that, Commissioner. I appreciate your report. I know that this is the last topic on your report in regards to pregnant women and the possible parking placards being offered. It's a topic that, we may want to that we may have opinions on, but because this was already part of the report, this can be discussed at the next board meeting.
This is Andrea. Just to clarify, taking action can happen at the next board meeting, which I think is what Wes was saying. But reactions and questions are certainly welcome now. Right.
Yes, that's correct. So, Olivia, you can go ahead with your question or comment. Thank you again.
Yeah, the commissioner answered what my first question was, and that was whether Boston was going to use home rule or some other legal mechanism to try to get the RMV to issue the permits, but thankfully it's up to the RMV. And pregnancy is a medical condition. It's already, if it causes disabling side effects, it's already qualified.
Yep, you're right on both counts. So, like I said, I think that our conversation with the city councilor was really just to educate them on it. He's a new city councilor. He was just inaugurated, so it was a learning opportunity, I think. But the city,
bless his heart.
Yeah, the city won't be pursuing any home rule petition on this.
Okay.
I'm Wes here. I actually have a comment that I wanted to proceed with my comment before others. I just wanted to let the commissioner know that under the ADA guidelines, pregnancy is not considered a disability under the Americans with Disabilities Act. However, there are some pregnant women who may have disabilities that are, they may be impaired by their pregnancy. So I'm not sure if maybe we need to look to federal guidelines and, so I just kind of wanted to throw that out there and have that comment made. Jerry? Or Zeri, excuse me.
Jerry, go ahead.
What did you stop?
Jerry, interpreter, misspoke. I apologize.
Jerry?
Jerry.
Oh, thank you, yes. Thank you, Wes. This is Jerry. I appreciate, Commissioner, you taking this learning opportunity with the counselor. Was his office receptive and appreciative of your comment, of your meeting?
Very receptive, and like I said, I think it was very well intentioned. I don't think it was, done to cause any harm. I think it was all with the best of intentions, just, not being familiar with the program. So we did talk about still, if he's still interested in hosting the hearing, that we could use it as an opportunity to spread this information to people who are pregnant, because they may not know they can apply for a placard, and we would certainly encourage that if they do have disabilities. So yes, he was very receptive and very friendly, and like we said, there was no ill intent at all, we're sure. It's just being new and not really knowing all the programs that are out there.
Oh yeah, when I saw a news story on this. I didn't take it as him being ill-meaning at all. You know, he just wanted to try to increase access for folks that he thought might need it. You know, which is always a good intention. But I'm glad your office was there and was able to meet with him. It sounds like it was very educational, so that's great.
And just a note on what Wes said about the ADA. Yeah, so the ADA doesn't list any specific diseases because it's not about like a categorical disease. It's about function and how it affects like major life activities. So it's pretty similar with the RME, except they do list a few explicit conditions. Off the top of my head, I can recall 2. So making pregnancy an explicit condition. I'm not sure if that's what the council had in mind, but like we said, we don't think it needs to be because if it causes a disability, it can already be approved. Zari, did you still have a question?
Yeah, I just wanted to say that, so it makes a lot of sense to me that if, as a result of this pregnancy, there are some complications that may result in a temporary disability, then that individual would be, of course, eligible. But my initial understanding of his proposal was that he wanted to basically give pregnancy a legitimacy of being able to get a placard or a permit, which is different than what we're explaining now, which is as a result of a condition, maybe something that results in a disability, you would be then eligible for a parking space. And I just want to be, even though this is not a city issue, I think if you wanted to, you could take this further. And parking is already difficult for many of us who are wheelchair users, who use mobility aids. And I hate to have, I mean, I don't want to be cold-hearted, but I also hate to have a competitive group by other competition where there's already very limited space for people who use wheelchairs and mobility aids, just for the fact that this representative was thinking about his wife and the difficulties she had. The other thing that really worried me, though, wasn't the temporary issuance of this, but then I heard something about the women who got it would then be eligible to keep it for 90 days after, which sounded just outrageous. I mean, why? I mean, maybe I misunderstood that, but if that's the case, I would really argue with that one.
Yeah, like I said, I think if there is a hearing, it will be more focused on getting the information out to people who are pregnant about the requirements that already exist. We don't have to pass a new law. It already exists. If you are pregnant, you have a disability, make use of what's there now. Don't wait for the legislation to change anything because you don't have to. So I think that makes the most sense, just using it as an opportunity to spread the word, because a lot of people, like the council's wife, maybe didn't know that she could have applied for one. So yeah, I think we're all on the same page. And I think the councilor is too. I think, like I said, it was just a learning opportunity.
Mrs. West, I wanted also to follow up with the question, the point that was just made from Zari, because some drivers with disabilities or people with disabilities who can't drive, right? Some of us do not qualify for those parking placards. So then why would we give pregnant women something that we are not eligible for when folks with permanent disabilities are not eligible? So that's another example, I think, of maybe some concerns about this. And the reason that residents of Boston who may or may not be eligible for this would argue with expanding the population who can use it. But then I will turn the floor over to Paulette. Go ahead, Paulette.
So I actually have two comments. One, the placard for the individuals who are pregnant would be a temporary one. It wouldn't be a permanent one. And the second comment that I want to make is that some of the private institutions in the city already do this routinely as long as the person brings appropriate documentation saying that they have physical limitations and that they need, this accommodation. Now, it is on private property, but it's already happening in certain sectors of the city. I just wanted to bring that point up.
Well, I know that, and it was in the hearing note, I didn't include it in my report, but there is, the council did acknowledge that some places, like stores and businesses, have pregnancy parking spaces. So, again, I didn't include it in my report, but it is in there. Like you said, it's a courtesy right now. So it does exist in some places, but the city doesn't have control over that if it's on private property.
Mrs. West, terrific. Thank you, Paulette. I appreciate that comment. I would also like to mention that the person who made the proposal lives in Dorchester, and I know that parking is extremely limited in Dorchester, so that may have been a factor in their thinking. Paul, go ahead.
Hi, this is Paul, and I just want to touch base with what the commissioner just said. I'm kind of reiterating, this was my comment. But also, I want to keep Councilor Fitzgerald as an ally, because he's, on another note, he's a very strong ally for mental illness, and he's willing to be on board with us in whatever we need. He's looking out for all aspects of all of us in general, and I know he's already met with Commissioner McPosh about a lot of these things. Thank you.
Yep, he's definitely wants to be an ally, and we'll definitely work with him moving forward. Thank you, Paul.
Mrs. West? Okay, great. Thank you. Thank you, Commissioner. Thank you, Paul. All right, any other questions or comments about the Commissioner's report or any of these topics? I guess this would be something that we can discuss in next month's meeting as well. We can continue it. We'll see what action we might like to take as a board. All right, other questions or comments from the Commissioner before we wrap up this part of our agenda? Okay, great. Thank you, Commissioner, for that report. Following on our agenda, we have the Architectural Access Report from Patricia Mendez.
Thank you, Chair. Hi, everyone. My name is Patricia Mendez. I'm the Director of Architectural Access for the Disabilities Commission. My Architectural Access Report today would be a brief discussion about door openers. Olivia, one of our members, brought up the question a couple of meetings ago about a particular building that did not have the door opener towards the outside. So we looked into that. We looked into that report. We talked to our sister agency, the Inspectional Service Department, and they reported that in that particular instance, the door was an egress-only door. Therefore, it did not require an automatic door opener. The building provided another entrance to the business, it was a pharmacy, towards the parking lot to a different side of the building, and that was meant to be the entrance. So I hope that answers that concern for that particular example. So what are automatic door openers? Automatic door openers are the buttons that we see in building that allows us to open the doors without actually pulling on the door. And they also close automatically. Next slide. Are automatic door openers required? The answer is nope, they're not required, unfortunately. They're very good and they provide enhanced accessibility, but the building code does not require. What the building code requires are two things. The amount of force that is required to open a door, and it also requires the maneuvering space around doors. So what happens is that when there's a building that has limited space and they cannot provide the maneuvering space around the door, they can install the automatic door opener, and then those space requirements are waived. So it's like an exception. Similar with the force of the doors. So the building code requires that the force for opening the doors are 5 pounds for interior doors and 15 pounds for exterior doors. So when a door is harder than that, heavier than that, they have to provide an automatic door opener to mitigate that force required. So we find the automatic door openers a lot in retrofits, in existing buildings. We have a few of them here at City Hall, especially at the entrances, because the doors are heavy and the weather is windy, so it's difficult to open and close those doors. So that's a good example for the automatic door openers. In a landlord scenario, a renter can start by asking the building manager to adjust the door closer so the door can be opened with the required force. So that means that they don't necessarily need an automatic door opener. The first step from a renter's point of view should be to speak to building manager and try to first adjust the door closer, which might be like an easy, immediate fix. Something that, done with a screwdriver, that's all. Next slide. Okay, I already talked about this. So the requirements for doors is 5 pounds maximum force for interior doors, and for exterior doors is 15 pounds maximum. And then I included a link to 521 CMR, which is our Massachusetts Architectural Access Board code. And in that link, there's more information about the specific space requirements around doors on the pull side and on the push side. So you can refer to that if you like. And that's it. And if there's any question, then I'm happy to elaborate.
Can I jump in for a moment before we take questions from the board, Wes?
Sure. Yep, go ahead.
Thank you. Patricia, could you also talk just briefly about door handles? Because I know with my particular disability, they make a difference.
Okay. I didn't put anything on a slide, but I can make other slides for future meetings. So the handle on the doors are are related to the shape of the door handles. In old buildings, we find that the old doors have knob door handles, which are difficult for people with dexterity issues because the building code requires that the door handle are the lever type, and they don't require any twisting. So a compliant accessible door handle would be the lever kind, not the knob kind. And another requirement for the door handles is that it have to be in a range of height of the doors. They can't be too low or too high.
Thanks, Patricia.
You're welcome.
Okay, thank you. This is Wes, and Olivia, I see your hand. Go ahead.
I highly appreciate this, Patricia. Thank you. And
welcome.
And I'll be sure to spread this information to the apartment complex I live in, to the task force, because we are directly across the street from this location. So a lot of the elderly in my building are like, why doesn't that door have handles? Blah, 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 blah. So it was something that I took on and agreed with. So knowing that that's exclusively an egress door is something I can give them an answer for.
Perfect. That's a great question. And it's a common question that our office receives about the door, the automatic door openers.
Okay, this is Wes. Zeri, I see your hand up for a question or a comment.
Thank you, Patricia. This is great. So my question is, for people who are not able to use the lever, the accessible lever, what are the options then? Because I'm familiar with the 5-pound max and the 15-pound, but there are still a lot of people who don't have any use of their hands, and I know that this is not a city, but more of a federal guideline that we're following. But at the same time, I wonder if there's a way for us to, I don't know, advocate for automatic doors to become part of that accessibility. Because, for example, people who have high-level spinal cord injury are not going to be able to push the door with their hands. So there needs to be, some of them are not even able to use those push-button automatic doors as opposed to a sensor opener. So we need to kind of think a little bit about outside of the box about what are the population of people that really need to have this access. So I don't know if this is a question or a comment, but just something to just be aware of and maybe advocate for in the future.
Yes, Sarah, absolutely. So the technology exists in the motion detector technology, and retail stores, they use it because they want everybody to come in and spend money. So the technology is there, and they do it voluntarily, not because they're required by code. So when we are involved with projects in the Article 80, we always advocate for automatic doors for us, and we advocate against revolving doors. They're awful. So that's why we do day in and day out, because the technology is up there, but not as a code requirement.
I actually had a quick question, Jay, here about about the automatic doors. As far as City Hall goes, I know that they have several doors that are automatic within City Hall, and I'm assuming that not all doors are automatic, though. Is that the issue that needs to be addressed? I mean, would we think?
The exterior doors have automatic door openers. So, for example, in the first floor towards Faneuil Hall, those have automatic door openers. Going up on the second floor, the newer entrances, those have also automatic door openers. They have buttons. So that one is taken care of, so that's also accessible. And the one on the third floor, they are combination. There is 2 revolving doors and 2 regular doors, and one of the regular doors has an automatic door openers. So the three entrances are accessible with openers, or with automatic door openers. Did I answer your question?
You did, yeah. What about above the 3rd floor, though?
Okay, so above the 3rd floor, there's no more entrances. I don't think that are presently used. Did I answer your question?
Yes, you did. Yes. Okay, were there any other questions from board members in regards to this report? Thank you so much.
You're welcome.
All right, next on the agenda is the announcements. Do any board members have any announcements to share? All right. Now let's talk about old business. We need to have a motion for 2 votes. The first being the letter of support for the statewide dissemination bills. Did anyone have any other comments or questions from that letter that you read?
Just to clarify, the statewide captioning bill.
Captioning bill?
Wes, this is Jerry. I move to approve the open captioning bill. Approve the letter of support for the open captioning bill.
Okay. Who would like to second that motion, Jeremy?
This is Carl, I'll second.
Okay. And all in favor, please raise your hand or say aye.
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 Any opposed? Okay, so this letter of support will move to pass. Thank you. The second we need a motion to vote on is the statement of our board's neutrality on the end-of-life options. Does anyone have any questions or captions about the statement? Charlene has his hand raised. You can go ahead.
Hi, this is Charlie. I did miss last week's meeting and reviewed the minutes and then also the video. I just wanted to reiterate, I know that the commissioner brought this up when this came up about the, taking a position on something may require that we have to reach into our constituencies. We have to do polls. It requires work. So my question is based on principle. I'm not absolutely clear and understand what a position of neutrality means and so I'm having a difficult time with this, but if the board goes to vote, then of course we have to take a vote, but I didn't know if anybody had a definition, a clear definition of principle of what the statement of neutrality is.
This is Carl. I didn't see it as a statement of neutrality. I saw it as this was such a complicated decision that the board can't come to a consensus. So rather than come to a consensus, let everybody individually do their own thing outside of the board.
Hi, it's Kristen. Andrea put a statement in the chat. And Charlie, just for clarity, the neutrality is on the bills. It's not on the topic. You're neutral on both bills, so you're not taking position on the bills.
So the board will not be taking a position on the bills. Charlie, does that answer your question?
Yes, thank you for the clarification.
Okay. Thank you. Jerry has his hand raised. Can we go ahead?
Yes, thank you, Wes. I'm a little bit unsure myself because I thought at the last board meeting we had decided that it didn't need to be, we didn't need to make a formal statement regarding neutrality around the two bills, and yet here it is being brought up at the next meeting. So I'm just wondering about why the executive committee felt strongly that it needed to be formalized.
I'm happy to take this unless you want, Wes.
Go ahead, Andrea.
Great. So per the recording and the notes that we had generated, a question was raised, should we have a statement? And Wes, as chair, said we can certainly draft a statement if folks would like it. No one objected to that, so the executive committee took that to mean that the board did in fact want a statement that could be referred and sent if requested by constituents or folks that you interact with. So the vote was already taken, the position has been taken, but there was that question raised about an agreed upon sentence to share if members of the public ask any of you for the board's position.
Okay. Again, I guess I was unclear at the conclusion of the last meeting. Thank you for clarifying.
Thank you, Andrea. That was exactly what I was about to say. So, Richard, I see your hand is raised. Can we go ahead?
I sort of had the same question Jerry had. To whom is this letter going? Or the statement going?
Well, as of right now, the letter will not be, the statement, not a letter, just to be clear, will not be going to anyone. It is for the event that somebody may ask what our advisory board's position is, so that we do already have a neutral statement available to show. If nobody asks for it, we won't be showing it. It's just in preparation in the event of.
So if any of us get an inquiry, what all we're going to do is share the statement.
Yes. Yes. Any other questions or comments about the statement? Okay. Does anyone want to make a motion to approve this statement from the board of neutrality?
This is Jerry. I'll make a motion to approve.
Would anyone like to second Jerry's motion?
I second it.
Okay. So that was Zary? Okay, great. All right, so all in favor of this statement, please raise your hand or say aye.
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 I'm seeing,
For the record, I'm opposed, as I said at our last meeting. I've studied the bills and I think they're worth supporting. So I can't really support the statement.
I'm not sure who's speaking. Who's speaking? Okay, so we have 7 voting, okay.
That was Richard.
All right, so 7 voting aye in favor, and 1 who, please raise your hand if you're opposed to the bill.
To the statement.
To the statement, excuse me. Okay, so we have 1 opposed and 7 in favor. All right, so let the record show we do have 1 opposed to the statement. The statement has passed. Thank you. And now I would just ask for
Abstentions?
abstention. So no abstention.
This is Elizabeth. I'm a yes vote. I had problems with my
Okay. Thank you, Elizabeth. All right, so 8-1, the statement motion has been passed. Thank you. All right. Any other old business that needs to be discussed? Then we move on to new business. Does the board have any new business they would like to bring up?
Go ahead, Charlie.
Hi, this is Charlie. I'm not sure how to frame it for new business, but if it could be and I know that we're running out of time, but just a conversation. In both Chair West, you had kind of put this in there about communicating with you or Vice Chair about any topics or issues to be brought up, and then Commissioner Akash brought this up in a report too, kind of showing some of the things to achieve for 2024. I would just kind of ask, and I think this happened last year, early on in the commissioner's report, and maybe also in the chair's report, kind of the goals and the objectives for the commission and also the advisory board for the given year. If there is an exercise or if there is some sort of deliberation that we have to kind of discuss that and bring up topics that we'd like to see achieved for this coming year, and I don't know if it's going too far out, but anything long-term and short-term for this commission, so that we can kind of project to the communities what we're trying to do for a given year.
Mr. West, Charlie, thanks for the question. I think that maybe working subcommittees that could be established to talk about the goals and objectives for the current year. I think it sounds like something that a subcommittee would be responsible for, and I think the board can certainly do that. We can participate in the discussions outside of our monthly meetings. I would recommend that to be a subcommittee's responsibility. Any other thoughts or comments about that question? Commissioner?
Just one thought I had. It could always be something that the board could take a vote on at a meeting if you want to propose something that you're particularly interested in, or the subcommittee could potentially brainstorm some areas where they are interested in and think the board may be interested in, and you could figure out a way to create priorities. But I think there is some work that can be done with that, whether through subcommittees or through some work with the executive committee. But we can take that back in our office too and try to think it through a little bit, Charlie. So thank you for that.
Mrs. West? Yeah, we can think about that, and if folks are interested in participating, then please let me know if that subcommittee sounds interesting to you. We'll figure out what is possible, and we can have conversations in further detail next month. Also, feel free, to, like I said, set up one-on-one meetings with me if you have particular ideas you'd like to share. As I mentioned in my report, I'm very open to that. Okay. So I know we're running a little bit over time. I'm just looking to see what's next, what's left on our agenda. Sorry, bear with me 1 second. Yep, I see you. Sorry. Hi, kids. Hold on 1 second. Okay. So now is the time of our meeting that we reserve for public input. Would anyone, members of the public, like to comment on the question?
This is Andrea. For members of the public, if you'd like to speak, please raise your hand or use the chat function to let me know. I can send you a request to unmute. Public comment is limited to 2 minutes. Thank you.
That 1 minute or a few more moments to see if members of the public would like to be recognized.
Wes, I'm not seeing anything in the chat for members of the public seeking to be recognized.
Okay. Mrs. West? All right, seeing none, may I request a motion for adjournment, please?
Carl did have to leave a little early, so someone else might need to step up.
This is Jerry. I will move to adjourn.
I also see Olivia. will second Jerry's motion to adjourn?
I'll second.
Great, thank you, Paulette. Okay, all in favor of adjourning this meeting, please raise your hand or signify by saying aye. Meeting is officially adjourned at 7:36 p.m. I hope to